Hello, Fallbrook Rotarians. Thank you for taking the time today to review our presentation. We have been very fortunate at the Foundation for Senior Care to receive support from the Fallbrook Rotary for many years, both collectively and personally. And we're honored that you continue to stand with us in our mission to minister to those seniors in need throughout our community. At the Foundation for Senior Care is to provide programs and resources that enable seniors to enhance their well-being and help them enjoy a more meaningful life. Last October, we celebrated our 40th year in existence. From the earliest days as the Fallbrook Hospital Foundation to our current identity as the Foundation for Senior Care, we've been a trusted resource and nonprofit organization for seniors throughout that time. Our programs really revolve around our four core programs: our adult daycare, our senior care vans, our care advocacy, and our door-through-door programs. The daycare center, which we know as the club, provides a day program for seniors with cognitive issues, suffering from dementia very often, and those disabled adults who need additional care and support. This program provides socialization and enrichment activities to keep them stimulated, to keep them engaged, but also very importantly, it allows respite relief to caregivers. Our senior care vans, we provide over 6,000 rides each year to seniors to get to their doctor's appointments, to the pharmacy, to physical therapy, for rehab, to the grocery store, and even the beauty shop, allowing them to remain engaged in the community. Our care advocacy program provides referrals, resources, education, and advocacy for seniors and disabled adults in healthcare and housing, covering basic needs, social services, veterans affairs, and national entitlement benefits that they may not be aware of. And our goal always with care advocacy is to help seniors age in place. We want them to live safely and to age with dignity in place in their homes, if at all possible. Our door-through-door program was born out of that care advocacy process and noticing that the disconnect in communication and case management for seniors leaving the hospital and trying to address the ongoing problem of readmission. So we wanted to make sure that there was a smooth transition and most critically, proper communication as a senior is discharged, getting them home, getting them reacclimated to their environment at home, making sure that they have adequate food, making sure that there's a full safety evaluation of their home to identify any risks for falls, which is a very common incident that takes place. And the goal is to really provide them the best environment to heal following a medical event. So what happened recently? Something that nobody could have foreseen to the scale that it's taken place, but COVID-19 came along and changed all of our lives globally, but certainly here in this country and specifically within our own region. On March 19th was the official day that the shelter-in-place directive was given, and this left many seniors confused on how they could address basic needs like food and personal hygiene items. So we very quickly had to assess our organization and our current programs and monitor how they were being impacted by the shelter-in-place directive, but also determine how we could quickly respond. What is the best way that we can serve our seniors in this moment of crisis? And we noticed that there was hoarding going on at the stores. There was this first wave of panic, I think, that set in. And there were lines, there were limitations on certain paper products, as we've all become aware of, and certain staple food items as well. And we began to notice that there was an immediate response required for us to help our seniors, whose lives were at stake, essentially. You know, with a large percentage of our seniors in the most severe risk category, many of them over 85, which is the highest mortality percentage, the emergency grocery delivery service that we have come up with wasn't conceived as merely a convenience. It was a mandate to protect our seniors. Thankfully, we are very well connected with a network of partners, our community partners, the support we've received from the Fallbrook Regional Health District very early on in this process and connecting threads, The Legacy Endowment has continued to support us. The Fallbrook Food Pantry has been a sister organization in many ways with the great work they do with food insecurity, and they help collaborate with us many times as we do the assessment and the needs identification for seniors, and food is a big part of that with the food pantry for those that are income eligible. And the Chamber of Commerce, of course, the team there has always been very supportive in promoting our services to the seniors throughout Fallbrook. And our volunteers have been critical. Any nonprofit organization lives and dies by their volunteers, many of which are Rotarians throughout our time. And we have a very strong presence from North Coast in the volunteer group. And they are out there driving with us. They're out picking grocery items from the shelves for us. So our emergency grocery delivery service has, in a very short period of time, grown rapidly. It's like becoming Amazon Fresh overnight. So we looked at our existing resources, our board of directors. We sat down with our executive committee and said, how can we best redeploy our staff and our assets to help these seniors? And it was the grocery delivery service that came up as the best possibility with our care vans and our existing driving team, and turning our care advocates and our club staff into order fulfillment and logistics. So this rapid shift in services really transformed our existing day-to-day services, but it allowed us, from day one, we were giving 3 grocery deliveries that first day, and in less than 3 weeks, that has grown to 25 to 30 grocery deliveries per day. As of today, we have delivered over 330 separate grocery deliveries to folks here throughout Fallbrook. This is all done at no cost. There is no delivery fee charged by our organization. That was a decision we made right out of the gate. We wanted to make sure that there was no barrier for folks that needed groceries that were presented with a higher risk of infection and exposure being in the grocery store. We wanted to make sure that cost wasn't a barrier for them. And that was a challenge in many ways because we lost our primary source of revenue with our daycare. That makes up almost 25% of our annual budget is the fees from our daycare. So without that, we found ourselves bleeding a little bit financially, but there wasn't time to worry about that. We had to act quickly. And thankfully, generous donors have stepped in and allowed us to make this sustainable early on. And we're continuing to rely on the help of donors and individual sponsors to make sure that we can continue driving these groceries out to those who are in need. Even with our emergency grocery delivery service taking place, we are still continuing to offer our care advocacy services. In this time of anxiety, these issues are becoming even more important. They need economic and housing counsel quite often as the financial cataclysm that nearly took place has finally begun to stabilize, thankfully. There was a lot of worry about how to reduce utility costs. So we work with SDG&E very closely and get folks signed up for their reduced rate programs. Something that emerged was the scams and the predatory nature of certain individuals in these times of vulnerability. And there are numerous scams taking place that prey on seniors, especially those that are looking to receive stimulus checks. And our job as care advocates is to make sure that they're aware of these and to inform them on how to reject them or secure themselves, protect themselves against such predatory activity. Our door-through-door program is continuing to operate as well, and while we may not be able to actively transport folks back and forth to the hospital, we continue to coordinate remotely so that they have all the resources they need in returning from the hospital so that they can safely heal at home. That's always the goal of that program. And our door-through-door coordinator does a lot of the assessment up front for folks that ultimately go to the food pantry. And then we will help out not only in that early needs assessment for the food pantry, but as backup. We have been delivering a number of groceries in coordination with the Fallbrook Food Pantry as well. These are some of the testimonials we've received from our seniors, and these are the kind of things that make you get up in the morning. We have an option when we process a payment. So the senior calls in this first part of the order delivery process, and they put a payment on file. We run that payment. We shop for the groceries. We call the senior back to confirm that payment, and then we deliver the groceries. They're sent an email often afterwards if they have access, and they write these reviews. And this was something unanticipated, but it really touched our hearts to see their gratitude come through. This is some of the testimonials on screen are just a small slice of what's been almost 4 dozen positive reviews we've received so far, and it keeps us going in this program. How can you help as the Fallbrook Rotary? Well, certainly we always welcome donations. That is what keeps the boat sailing here. That's what keeps the groceries being delivered. That's what allows us to meet the needs of our community. But volunteers are always welcome, and they remain critical. We need that extra capacity from a labor standpoint to be able to get out there and make these drops. So we welcome any volunteers. You can reach out directly to Teresa Tresitano, a fellow Rotary member and who spearheads much of our outreach and has really done a great job in helping structure this program as well as a whole. And any donations can be done right at the foundationforseniorcare.org at our website. You would just click on the donate button at the upper right-hand corner, and you can make any donation amount helps. Doesn't matter if it's $10 or $1,000. They are critical to us being able to execute our mission. And thank you. That's the most important part. We never are short on gratitude here. We know how reliant we are on people's compassion and their altruism, and Fallbrook Rotary is the perfect example here locally of that kind of continued ethos of service over self. It's something that we vibrate with philosophically, but we also appreciate the practicality of the Rotarians, that it is really about making a tangible difference, about making a meaningful impact in our community. So thank you, everyone, and thank you for continuing to support our organization. And we look forward to seeing you out there.